Welcome back to the American College of Surgeons Bulletin Brief from the Frontline Surgeons' Voices. With me today is a friend of mine for well over 3 decades, Dr. Gerald Eisenberg. Dr. Eisenberg is with us today in his role as Editor-in-Chief of the ACS Case Reviews in Surgery. Welcome, Jerry.
Thanks, Steve. Good to see you.
Always a pleasure to be with you. Wish it was in person and hope this
True.
will be. Tell us a little bit about the ACS Case Reviews in Surgery. How did it come about? When did it come about?
So it came about 5 years ago. It started after a conversation I had with Dr. Sachdeva, who's in charge of education at the ACS. I think almost everyone knows him. And it was a casual conversation at a meeting and just kind of talking about, hey, Sach, surgeons love case reports and it's really hard to get them published. So why can't the college do that? And it led to a number of months of discussions, and then we were able to accomplish that. So we were very excited about being able to do it.
How often do the case reviews in surgery get published?
We're on about every 2-month schedule, though we're trying to increase that to monthly. So it's really a production question, and we're trying to increase that for our readership.
Is it distributed in some way on paper, or is it strictly electronic?
It's always been electronic. Initially, we were a subscription publication, but now it's open access. So anyone can get it through the ACS website.
So open access, of course, raises the question that it's not the subscriber who is paying, but rather the author is paying.
Yes, the author has a fee once it's reviewed by our reviewing staff and editorial board, and then there's a fee for publication.
But the good news for the reader is it's free, it sounds like.
It's free for the reader. If the reader wants CME credits, there's a way to subscribe to get CME credits for going through the journal.
Okay, so we're looking at the link here for how one would access the ACS Case Reviews in Surgery. Give us an idea of how many articles there are in a given issue every other month, or cumulatively how many in a year, and what types of topics are covered.
We have somewhere between 15 and 20 case reports that are in each issue, and the topics are very wide-ranging. They go from general surgery to some of the subspecialties within general surgery, vascular, cardiovascular. We have some ENT publications that have come through. We try to appeal to a very broad audience, and I think we've accomplished that. We have tried to push through our editorial process any articles that are worthy of publication on COVID, so that we're highlighting that and pushing it forward quicker.
What would you say the hallmark is, the sort of common denominator or denominators amongst these very varied specialties and subspecialties which are being published? Is it the images? Is it the oddity of the cases? How might you classify it?
It's kind of all of the above. Obviously something with a nice image, everyone loves that, so we try to publish that. But also, more unique cases, things that people don't see very often, or if it's a more common problem but handle it in a different way. Those are things that we like to highlight.
That's great. And you say you can get a CME credit for reading these case reports as well.
Yes, the college creates the questions.
So it'd be probably very useful for residents, fellows, medical students, as well as their supervising staff to know how to submit.
Yeah, just go right through that link, and there are detailed instructions how to submit to the journal, and we ask you to read them carefully and go through them so that you can do the exact method that we need in order for a quick publication.
Well, thank you very much, Jerry. It's always a pleasure being with you, and I congratulate you on this innovative concept of allowing surgeons to find homes for their interesting, unusual cases and their outstanding, unique, and high-quality images. The fact that the ACS Case Reviews is now around allows a repository of that great material. So I'm sure it's a big time investment, and we appreciate what you're doing.
Thanks, Steve. I'm always happy to talk about it, and it was great spending some time with you.
Likewise, stay well. Look forward to seeing you in person.
Absolutely.